Doctor, we have a video question and it's from Stacy. Let's take a look.
Hi, I'm Stacy Stevens. I'm wondering if there's anything else that can be done for tachycardia besides medication. Thank you.
Oh, good question there. Thank you, Stacy.
Yes. Okay, Stacy. So tachycardia is defined as a heart rate of greater than 100 beats per minute. And people can have elevated heart rates for a wide range of reasons. You can imagine something as benign as being surprised, that causes your heart rate to go up. Or you can imagine as something as deleterious as having a septic infection and the heart rate increases because you need to increase your blood pressure and provide blood flow to your body. So having tachycardia in itself is not a problem. We need to diagnose what is causing the tachycardia. And like I said, if it's because you're surprised, then fine, no more surprises. If it was because you had an infection, then it's treated with fluids and antibiotics. And there's a whole slew of different causes of tachycardia in the middle of these two extremes that can be managed differently. So whenever someone has tachycardia, the first thing that we need to do is determine what is their EKG, the electrical cardiac activity, and also get a physical exam and history to determine why they're having the tachycardia. Once we've done that, we can best figure out how to manage it. And I would say that the majority of the times, we do not manage it with medications. You can manage it with lifestyle changes, with dietary changes, and it can be very effective if it's followed appropriately.
And if it isn't treated, doctor, can there be complications?
So if it's not treated, but it really depends on the type of tachycardia. So if it's a sinus tachycardia, which is a normal type of fast heart rate, then generally there isn't a complication unless the heart rate is fairly fast, above 130 beats per minute. But for example, we have lots of patients who have a condition known as atrial fibrillation, which is an irregular heartbeat, and their heart rate is generally at 100, 110 beats per minute, and they do well. There are certain patients where the heart rate is very fast, 130, 150 beats per minute, and they do develop this condition of heart failure that we've talked about, where the heart weakens. So it really depends on everyone, but generally, whenever I get a patient who has tachycardia, there's a lot of different things we can do to help slow down the heart rate, and I rarely just prescribe medications. I try to find out what's the cause of it and treat the underlying cause. If, for example, if you have tachycardia because you have an infection, and I give you medication to slow down the heart rate, that could potentially be life-threatening. What you do is you treat the infection, so your body naturally decreases the heart rate on its own rather than you forcing it to come down. And there's a lot of conditions like that.
Doctor, I want to go now to kind of the most common type of heart disease, which is coronary artery disease. Coronary artery disease. Let me correct myself there. What exactly is that, and what are the symptoms there?
All right, excellent. I'm glad you brought this up, Olga, because as you mentioned, it's one of the leading causes of heart disease in America. So coronary artery disease refers to the fact that the arteries, which are the blood vessels that supply oxygenated blood to our body, start developing a plaque buildup. In coronary artery disease, we're referring to the arteries that supply the heart in particular. So what happens is that as we age and our cholesterol is floating through our bodies, it can actually start to deposit within those artery and the arterial walls. Over time, this cholesterol can cause inflammation and a type of injury to the inner lining of the vessels. That can then lead to a narrowing of the vessel. If that vessel narrows significantly, then the heart can't get enough blood flow in order for it to supply its oxygen demands, and it essentially starts to cramp. When it starts to cramp, most people experience that as chest pain with exertion, difficulty breathing with exertion, nausea, vomiting, or abdominal discomfort. Interestingly enough, in women, it's most often chest pain, shortness of breath, nausea, and abdominal discomfort, with abdominal discomfort being more common. In men, it tends to be more chest pain and difficulty breathing. But it's still the same mechanism. The heart isn't getting enough blood flow. If it becomes very significant, then we have to fix it. And there's different strategies for fixing it. We can fix it with, the first strategy is always diet, lifestyle. If that's not enough, medication. If that's not enough, then we go ahead with some of the procedures that I do as an interventional cardiologist, where I put a little piece of metal called a stent that opens it up, or potentially, if that's not effective, then we go ahead and do something called coronary artery bypass graft surgery, otherwise known as cabbage.
So, doctor, I want to get through a few things. And again, time is of the essence here, but I think it's important to talk about high blood pressure. Number one, why it's so important to maintain it. A lot of people think it's 120/80. I think those numbers have changed, and why it's so important, because it's the silent killer.
So great question. Yes, hypertension is considered in cardiology a disease of adolescence, because what happens is that if we don't take care of our blood pressure when we're young, eventually it can lead to problems in the future. So the recommended blood pressure is that the systolic, which is the top number, is less than 135, and the bottom number is less than 85. That's a recent change from a few years ago, where the systolic blood pressure had to be less than 140, the top number, and the diastolic had to be less than 90. And what ends up happening is that, as the video so well defined, having high blood pressure causes injury of the inner lining of these vessels, which then that promotes the plaque buildup and the narrowing that we talked about that happens in heart attacks and in coronary artery disease. That narrowing can happen in the kidneys, can happen in the brain, as well as the heart, as we talked about. So it's really important that we try to control our blood pressure. And nowadays, the goal is the top less than 135 and the bottom number less than 85. Important, when you measure your blood pressure, you need to measure it when you're at rest. Because if you're excited or stressed out or you've just exercised, it's normal for your blood pressure to be elevated for short periods of time. So you want to make sure you measure your blood pressure while you are at rest.